Welcome dear students. Today we will discuss the topic of right atrium. Right atrium, it is the chamber of the heart which will receive the deoxygenated blood from all parts of the body. The right atrium, it will receive the three major veins that are the superior vena cava, which will bring the deoxygenated blood from upper part of the body. The second major vein, it is the inferior vena cava, bringing blood from the lower parts of the body, and the third vein which the right atrium it receives, that is the coronary veins, which are the veins of the heart itself. So, these are the three major veins which will bring all the deoxygenated blood from all parts of the body to the right atrium. From the right atrium, all of this deoxygenated blood, it will travel to the right ventricle, and the opening of the right atrium into the right ventricle, it is guarded by a valve, that is the tricuspid valve. Now, if we look on the external features of the right atrium, it is a quadrilateral chamber, as we can see here. This is the right atrium, and this surface of the heart which is shown, it is the sternocostal surface of the heart. Now, this quadrilateral chamber, right atrium, the anterior and the superior end of the right atrium, it is prolonged as an ear shaped projection. This one, the right auricle, this right auricle will cover up the root at the arch of the aorta and extend up to the pulmonary trunk. The demarcation between the right atrium and the right ventricle externally is also marked as a groove, that is the right part of atrioventricular groove or the coronary sulcus. And in this atrioventricular groove is present the right coronary artery along with the anterior cardiac veins. So, this is the introduction of the chamber, that is the right atrium, receiving all the deoxygenated blood, and shape of the right atrium, it is quadrilateral, and we can see the prolongation of right atrium towards the left side as the right auricle. Now, along the right side of the right atrium, where it is forming the right border of the heart, a shallow groove is present at this location. This shallow groove, it is named as the sulcus terminalis. The importance of sulcus terminalis is that this groove will extend from the opening of superior vena cava up to the opening of the inferior vena cava, and SA node is lying at the upper end of this sulcus terminalis. So, this sulcus terminalis will show the location of the SA node, which is at the upper end of sulcus terminalis. The right atrium, it will extend from the third costal cartilage to the sixth costal cartilage. Now, regarding the relations of the right atrium, as we see in this diagram, here it is the right atrium. The right atrium, it is covered anteriorly by the anterior part of the mediastinal surface of the right lung along with its pleura, and these mediastinal surface of right lung and pleura, they are separated from the right atrium by the three layers of the pericardium, that is the one layer of fibrous and two layers of the serous pericardium. Along the lateral side, the right atrium, it is related to the cardiac impression of the right lung, from where it is separated by the pleura and the pericardium. But between the pleura and the pericardium, important structures are lying, as we see in this second diagram. Here we can see this right phrenic nerve and the pericardiophrenik vessels. The pericardiophrenik vessels, they are branches from the internal thoracic artery. So, these structures, they will be forming the right relations of the right atrium lying between the pericardium and the pleura. Posteriorly, the right atrium, it is related to the left atrium along with its pulmonary veins. So, these are the relations of the right atrium to the lung, pleura, and it is covered over by the pericardium. Now, the right atrium, it is lying on the sternocostal surface of the heart, but it is also forming the right border of the heart as we see in this first diagram, and the right atrium, it will also form a part of the upper border of the heart. The upper or the superior border of the heart, it is formed by the left and the right atrium, and right 1/3 will be by the right atrium. In addition to this right atrium, it will also form a part of posterior surface or the base of the heart. In the second diagram, we can see the posterior and the diaphragmatic surface of the heart, where the right 1/3 of the base, it is formed by the right atrium. So, right atrium, it is contributing to the sternocostal as well as the posterior surface or the base of the heart. Now, these are the external features of the right atrium. Now, we will study the internal features of the right atrium. Now, if we give a cut along this margin of the heart, that is the sulcus, along the sulcus terminalis, we can clearly see the internal features of the right atrium like this. Now, we have given incision along the right border, and we have reflected the anterior wall of the right atrium, and we can clearly see here that the right atrium in its interior shows two distinct features. That anterior wall of the right atrium, it is completely rough in texture, while the posterior wall of the right atrium, it is smooth in texture. So, these two parts of the right atrium, they are not differing only in their gross features, but they are also embryologically different. The anterior part of the right atrium, it will be derived from the right half of the common atrial chamber, while the posterior smooth part of the right atrium, which is also known as the sinus venerum, it will be derived from the right horn of the sinus venosus, which we will study in the next slides. And these two parts of the right atrium, the anterior rough and posterior smooth part, they are separated from each other by this rough ridge, which is named as the crista terminalis. This crista terminalis is located just beneath the sulcus terminalis, which was present on the external surface of the heart. Other features in the interior we can see here. This is the interatrial septum, which is present between the right and the left atrium, and on the interatrial septum, some remnants of the primitive septum as fossa ovalis, they can be seen. The fourth important feature in the interior is the presence of the opening between the right atrium and the right ventricle, and this opening is guarded by a valve having three cusps known as the tricuspid valve. And you can also appreciate from this diagram that all the major veins like superior vena cava, inferior vena cava and coronary sinus, they are all opening in the posterior smooth part of the right atrium. So, now we will discuss these 4 points in detail. First, about the rough anterior part of the right atrium. The rough anterior part of right atrium, it is also known as the atrium proper or the pectinate part, and this part of the right atrium, it is rough because of presence of these thick muscular ridges, and these muscular ridges, they are known as the musculopectinate, and we can see that direction of these muscular ridges is from the crista terminalis towards the tricuspid valve, and these muscular ridges, they will be more dense and forming a dense network like structure in the auricle part of the right atrium. And significance of this dense network in the right auricle is that it will make it more prone for the thrombus and the embolus formation. In if the blood stays in the right auricle for some time, it can cause the thrombus formation and embolus formation. So, this is the rough part of the right atrium, and embryologically it will be a derivative of the right half of the common atrial chamber. Now, another important point which we must note down here, that all the major veins, they are opening in the posterior smooth part. Only the anterior cardiac veins, which are bringing the blood back from the chambers of the heart, they will open in the anterior rough part. So, these are the only veins, anterior cardiac veins opening in the rough anterior part. The next part of the right atrium, it is the smooth posterior part of the right atrium, which is receiving the openings of all the major veins and is derived from the right horn of the sinus venosus. Now, the major openings which are present in this smooth part, superiorly we can see here, this is the opening of the superior vena cava, and inferiorly there is an opening of the inferior vena cava, and just to the left of the opening of inferior vena cava there is opening of the coronary sinus. Now, look at all these three openings. The opening of the superior vena cava, it is not guarded by any valve, but the opening of inferior vena cava and the coronary sinus both are having the valves. The valve of inferior vena cava, it is known as the Eustachian valve, while the valve of coronary sinus, it is known as the Thebesian valve. Now, these valves, the valve of inferior vena cava, it has an important function during the intrauterine or the fetal life, where this valve, it will direct the blood from the inferior vena cava into the left atrium. So, blood will not move into the right ventricle from the inferior vena cava, and this point has a special importance because in the fetal life all the oxygenated blood, it will be received in the right atrium through the inferior vena cava, and to the inferior vena cava the oxygenated blood, it is received by the left umbilical vein, and from the right atrium all the oxygenated blood, it will pass into the left atrium. So, the valve of inferior vena cava, it is rudimentary in adults, but in fetal life it has an important function of directing the blood from the right atrium to the left atrium, so that the oxygenated blood, it does not pass into the right ventricle. The valve of coronary sinus, it also has an important function that it will prevent the regurgitation back of the blood. So, whenever the blood is returned from whole of the heart into the right atrium through the coronary sinus, and when the right atrium contracts, there is a tendency that this blood will go back into the coronary sinus, but this valve will prevent this regurgitation of blood back into the coronary sinus. So, these are the three major openings in the posterior smooth part. One is the superior vena cava, second inferior vena caval opening, third is the opening of coronary sinus. In addition to these three openings, many small openings they can be seen, and these openings are the openings which are bringing back the blood from the atrial chambers, and they are these small veins, they are named as the veni cordis minimi, and these small openings they have a special name, that is the foramen venerum minimarum. Now, in addition to these four features, the fifth important feature in the posterior smooth part is the presence of an intervenous tubercle. This intervenous tubercle of lower is present just below the opening of the superior vena cava. Now, this intervenous tubercle, it is rudimentary in human beings, but it is said that this valve is functional in the fetal life, where it directs the deoxygenated blood from the superior vena cava into the right ventricle. So, these are the features in the smooth posterior part, a derivative of the right horn of the sinus venosus, and in this posterior smooth parts all the major veins they are opening, and opening of inferior vena cava and the opening of coronary sinus, they are having the valves. Now, the various tributaries which are opening in the right atrium, they were the superior vena cava, inferior vena cava, coronary sinus, and the anterior cardiac veins, they will open up in the anterior rough part. Rest all the veins, they will be opening in the posterior smooth part. And another major opening, it is the opening of the right atrium into the right ventricle, guarded by tricuspid valve. Now, the third are the features which are present in the interatrial septum. This interatrial septum will separate the right atrium from the left atrium. Now, in the interatrial septum, in the adult heart, we can see some remnants of the primitive septum, and these remnants, they are seen as, first is this oval shaped depression which is seen, this is named as the fossa ovalis, and this fossa ovalis, it is a remnant of a primitive septum, that is the septum primum. And if we look at the margins of the fossa ovalis, the margins of the fossa ovalis, they are sharp anteriorly and towards right and left side. Only the inferior margins of this, they are not clear. These margins of the fossa ovalis, they are named as the limbus fossa ovalis, and these are the remnants of a second septum of the interatrial primitive septum, that is the septum secundum. So, on the interatrial septum, we will see the fossa ovalis and limbus fossa ovalis, which are remnants of septum primum and septum secundum respectively. Now, the third feature which you will see along the lower part of the interatrial septum is the presence of this triangular area which is named as the triangle of Corks. Now, importance of triangle of Corks is that this is more clearly visible during the surgery and in the live hearts, and in this triangle of Corks, AV node is located. The boundaries of the triangle of Corks, they are, first boundary, it is by this subendocardial thickening which is named as the tendon of Todaro. So, this is the thickening present in the just below the, just in the interatrial septum, that is the tendon of Todaro, and this tendon of Todaro will form the superior boundary of the Corks triangle. The second boundary of Corks triangle, it is by this coronary sinus, and third boundary, it will be by the cusp of the tricuspid valve, that is the septal cusp of the tricuspid valve. So, this is the triangle of Corks bounded by tendon of Todaro, coronary sinus and septal cusp, and important feature is that AV node is located in this triangular area. So, during surgery, when we want to preserve or we do not want to injure the AV node, we have to be clear about this triangle of Corks. Now, other features which we can visualize along with this tendon of Todaro, which I have marked as number 2 and 3, which are present just antero superior to this tendon of Todaro. Now, the 2 number, it is the presence of the membranous part of interventricular septum which is projecting in the lower part of interatrial septum, and 3 is the Taurus Aorticus. Now, with the next slide, I will show in detail what do we mean by this membranous part of IV septum and Taurus. Now, first the membranous part of interventricular septum, which are forming a special projection in the right atrium. So, in this diagram we can see clearly that the right ventricle and the left ventricle, they are separated by this interventricular septum. But in the upper part of interventricular septum, we can see this special part that is named as the membranous part of interventricular septum. This membranous part of interventricular septum, it will actually separate the right atrium from the left ventricle. So, this part of the membranous part of the interventricular septum, it will form a bulge in the right atrium, which we have marked as a number 2. The number 3 which has been marked is the Taurus Aorticus. By the Taurus Aorticus, we mean the non-coronary aortic sinus. Now, as we know that the aortic opening, it is guarded by a semilunar valve. Now, this semilunar valve is having 3 cusps, and opposite the cusps of the semilunar valve, the aorta will show dilatations like this. These are named as the sinuses, and from these sinuses the coronary arteries, they will take origin. Since it is having 3 dilatation or 3 sinuses, and from 2 of the sinuses, the right and the left coronary artery, they will take origin, but one of the sinus, it is named as the non-coronary sinus, and this non-coronary aortic sinus, from which no coronary artery will take origin, it will also form a bulge in the right atrium, which is marked as the Taurus Aorticus, and it has been marked as the number 3 here. So, we have marked the 3 areas in the right atrium the Corks triangle, tendon of Todaro, and this one is the AV node, and above the tendon of Todaro I have marked the membranous part of interventricular septum and a bulge of the non-coronary aortic sinus in the right atrium. And other features which we have marked in the interatrial septum were the fossa ovalis and the limbus fossa ovalis. So, these are the features in the interior of the right atrium which is showing a differentiation into an anterior rough part and a posterior smooth part, and also a part interatrial septum, and the fourth part was this AV or atrioventricular orifice guarded by the tricuspid valve. And the two parts, the rough and the smooth parts, they are differing in their embryological origin also. On the interatrial septum we have marked the fossa ovalis and the limbus fossa ovalis along with the Corks triangle, and all the openings we must remember that they are in the smooth part of the right atrium, which is in the posterior part of the right atrium. Now, we will discuss how these two parts of the right atrium, they are embryologically developing. So, here we can see the heart tube. Initially there are two heart tubes which fuse to form a single heart tube, and in this single heart tube fusion does not take place at the caudal end, which is the venous end of the heart tube. The cranial end is named as the arterial end of the heart tube, and in this venous now, and in this venous end of the heart tube which has remained unfused, we can see these two parts which are named as the sinus venosus, and this is the right horn of the sinus venosus and this one is the left horn of the sinus venosus. Other parts of the heart tube, they are, this is the common atrial chamber, this is primitive ventricular chamber and the bulbous cordis, and we are concerned here with this primitive atrial chamber and the horns of the sinus venosus. Now, this primitive atrial chamber, as we can see in this diagram, it will be gradually a septum will develop in this primitive atrial chamber and it will divide it into a right and left part, and this common atrial chamber which will be divided, it will give origin to the rough parts of the atrium. So, the anterior part of the right atrium which we have seen, this is from this rough from the common atrial chamber. Now, these two horns, right and left horn, you can clearly see here that all the major veins, they are opening in these horns of the sinus venosus, and these veins, they are the common cardinal vein, umbilical veins and the vitelline vein, and out of these veins, the common cardinal veins, they will form the part of the superior vena cava, and this right umbilical vein will disappear and vitelline vein will form a part of the inferior vena cava. So, this right horn of the sinus venosus, by these veins we are clear that it will definitely form the posterior smooth part of the sinus venosus. But what will happen to this left horn? This left horn will of the sinus venosus, it will completely degenerate or retrogress. The only part which will persist from the left horn, it is the left umbilical vein, and this left umbilical vein will bring all the oxygenated blood through this sinoatrial opening to the right atrium. So, this is how the parts of the primitive heart tube, they will develop into the two different parts of the atrium. So, from the common atrial chamber, rough part of right atrium, and from the right horn of the sinus venosus, the smooth part of the right atrium will be derived. And why this smooth part, it has moved posteriorly, as we see in this next diagrams. The heart tube, which was initially a straight tube, it will keep on rotating, and this venous end of the heart tube, which is forming the atrium and the sinus venosus, they will keep on moving backward, and the left atrium will move to the last and will become the posterior most. And we can clearly see here that the ventricles, they will form the anterior part of the adult heart. Now, since the venous end it has moved to the posterior part, and we can see that the right horn of the sinus venosus, it is the most posterior part of the right atrium. In this diagram we are looking at the heart from the posterior side, and here it is the rough common atrial chamber, and this right horn of the sinus venosus, we can see it is the posterior most part, and all the major veins, since they are opening into this right horn, so this will form the posterior smooth part of the right atrium. So, now we are clear about the derivatives of the common atrial chamber and the right horn of the sinus venosus. Now, this left horn which has degenerated, later on it will become a part of the coronary sinus. So, these were the two parts of the right atrium, the rough anterior part and the smooth posterior part. Now, how the fossa ovalis and the limbus fossa ovalis they develop, we can see by the next diagram. So, this diagram is showing the development of the interatrial septum, how the partition will develop between the right and the left atrium. So, the first partition which will develop, it is named as the septum primum, and this septum primum will develop from the roof of the common atrial chamber, and it will keep on growing towards these atrioventricular cushions which are separating the atria from the ventricle. But this septum primum, it will not completely separate the right and the left atrium, a gap will always be left, and this gap is named as the ostium primum. Since primary septum first to appear, so septum primum and ostium primum, and why this gap is left we can see also from the same diagram, as we see that inferior vena cava, it is opening into right atrium, and this is receiving the left umbilical vein which is bringing all the oxygenated blood to the right atrium, and the blood from the right atrium, it should always reach to the left atrium, from where it will be distributed to all parts of the body. This is because placenta will bring all the oxygenated blood, and the lungs, they are not functional in the fetal life. So, we always need a opening between the right and the left atrium in the fetal life. And this other part which has been shown, this is the opening of the right horn of the sinus venosus. So, first septum, septum primum, first opening ostium primum. Now, the septum primum, it will keep on growing downward, and AV cushions, they will also keep on growing upward, and they will close this first opening, that is the ostium primum. But at the same time, degeneration will take place in the upper part, and now again an opening will be created. This will be the ostium secondum. Now, while this second opening has appeared, a second septum will also appear, that is named as the septum secondum. So, in this third diagram we can see that now the septum primum, first septum, and the septum secondum which has grown downward, and now an opening is created, that is named as the foramen ovale. This is an oblique opening from the right atrium to the left atrium. Now, this oblique opening has been created so that it can act as a valve to direct blood only from right to the left atrium. Now, as in the adult, when the child is born, now the oxygenation start taking place in the lungs, and now the oxygenated blood, it will be returned to the left atrium. So, pressure in the left atrium will keep on increasing, and this increasing pressure of the left atrium will push this septum primum towards the septum secondum, and it will close this gap, that was the foramen ovale. And in the adult, we have seen this remnants of the septum primum as the fossa ovalis, and remnants of septum secondum as the limbus fossa ovalis. So, this was the development of fossa ovalis and the limbus fossa ovalis, which we have seen in the interatrial septal part of the right atrium. Simultaneously, we can see this opening of the sinus venosus right horn, and this opening is having two valves, this right and the left valve, and gradually we can see this right venous valve is stretching out, and this right venous valve, which is a part of the opening of sinoatrial opening, it will result in formation of the valves of the inferior vena cava and the valve of the coronary sinus. So, this is in brief about the development of the various septas, how they will partition the common atrial chamber into right and the left atrium. So, first septum was the septum primum, first opening was the ostium primum, second septum is the septum secundum and second opening is the ostium secundum. But always remember that in fetal life we will all the oxygenated blood, it is received in the right atrium. From here it will move to the left atrium and will be distributed to whole of the body, and since the oxygenation is not taking place in the lungs in the fetal life. So, that is about the development of these various parts of the interior of the right atrium. So, now we have seen how embryologically they will be derived from the fossa ovalis, which is a remnant of septum primum, and limbus, it is a remnant of the septum secundum. And the anterior rough part of the right atrium, it is derived from the common atrial chamber, and posterior smooth part from the right horn of sinus venosus. Now, this was about the gross anatomy of the right atrium. Now, the applied anatomy related to the right atrium. Right atrium, it can undergo enlargement or hypertrophy if there is a stenosis of the tricuspid valve which is present between the right atrium and the right ventricle. By stenosis we means the narrowing of the tricuspid valve, and it can happen in conditions like rheumatic heart disease secondary to the rheumatic fever. So, right atrial enlargements can occur due to these tricuspid stenosis. Now, another anomaly which can be occurring in the right atrium is the presence of atrial septal defects. As we have already seen that there are septum primum and septum secundum, they will fuse together as the oxygenation of blood start taking place in the lungs, but if these septum primum and septum secundum, they do not come close to each other, there can be defects in the atrial septum. And most common type of defects are the ostium secundum defects. By the ostium secundum defect we mean, as we have seen in this diagram, where the ostium secundum, in the second diagram we can see this ostium secundum. Now, if this ostium secundum it remains large, it can remain large either because the septum primum is small or septum secundum has not developed. So, then this opening will be very large, and this is said to be the ostium secundum type of atrial septal defects. So, here we can see these ostium secundum type of atrial septal defects. First are that septum primum, it is very small because of excessive reabsorption of septum primum, and second type are showing when the septum secundum has not developed. In both the condition, a large opening is present between the right and the left atrium. As the pressure in the left atrium is very large, and if this opening remains large, there will be always a shunting of the blood back from the left to the right atrium. So, these are the atrial septal defects. Usually atrial septal defects, they are small type, they do not present at birth. We can diagnose them only by some diagnostic procedure or by hearing of the murmur, and they are diagnosed only when a child has a failure to thrive or he has exercise intolerance, then these defects they are diagnosed. And sometimes these defects are very small, so that there is no shunting, but if we see by sonography or other diagnostic procedures, we can see that this is the septum primum and this is limbus fossa ovalis, and a small defect is present which is named as the patent foramen ovale. And if the defect is small, there will be no shunting of the blood. But sometimes these defects of the right atrium and atrial septal, they may be associated with the upper limb deformities, and condition is named as the Halt syndrome, which is an autosomal dominant type of condition, when the upper limbs they will also have anomalies in addition to the atrial septal defects. So, this is about the applied anatomy related to the right atrium. So, we have discussed the right atrium in detail with its anterior rough, posterior smooth parts and the interatrial septum. Now, the university questions which are asked from the right atrium, they are usually full questions of 20 marks, where you have to describe all the external and the internal features, but other part which is asked from it are the embryology or the development of the right atrium, where you have to describe completely the common atrial chamber, how the rough part will develop from the common atrial chamber and smooth part will develop from the right horn of the sinus venosus, and why all the veins they are opening in this smooth part, and also describe in brief about the interatrial septum in this part. Now, the MCQs which are commonly asked from the right atrium are again about the anterior and posterior part of right atrium, how they are differing embryologically, and another important part is the location of AV node, which is in the triangle of Corks we have seen in the interatrial septum, location of SA node which is at the upper end of the sulcus terminalis. So, that completes our topic of the right atrium. Thank you.